Hi, everybody. Welcome to GW Center for Integrative Medicine. I'm your host of this Zoom podcast, Dr. Kogan, Medical Director, Associate Professor of Medicine at GW University in Department of Medicine. Please do subscribe if you like our videos. We are keeping all of these resources free for you. And on this channel, we give all updates on what's new in integrative medicine. We also cover topics over very significant breadth, and also, of course, we have the actual spirituality in medicine, or spiritual healing podcast portion of this channel. So today I'm going to bring up something quite interesting, fibromyalgia. So fibromyalgia is this kind of a wastebasket of diagnosis, if you will. Nobody actually knows often how to effectively manage this condition. Diagnoses are often given very quickly without actual careful assessment. And the reason I want to bring this up is because, well, I'm going to cover a particular aspect or particular driver for fibromyalgia, but I want to kind of highlight one critical aspect of fibromyalgia. It's kind of a very good show and tell why I think integrative medicine at the concept is so important, meaning that we don't stop at diagnosis, right? We always go under the diagnosis. We always try to figure out what drives the condition, because on an example of fibromyalgia, there could be 30, 40, 50 different causes of fibromyalgia, which just a label. And fibromyalgia often gets kind of, well, not confused, but mixed with this chronic fatigue syndrome. Often this condition thought to be interchangeable, which they're not. Chronic fatigue syndrome and kind of a chronic painful or chronic aching condition could be very different. They could be an aspect of the same. They could be an aspect of mold toxicity or mercury toxicity, and both could be basically just, in that case, misdiagnosed or simply labeled incorrectly. But kind of an interesting article I stumbled upon recently, and I'm going to go ahead and share the screen now with you. And so you can see the article. So could some of the patients with fibromyalgia have this low phosphate, or what we medically define as hypophosphatemia, or sometimes you can just say HPP, so for short, or hypophosphatasia, rather, I think would be the more appropriate, correct term. And, so a lot of the times we would get a test on a patient, and the test will show a low ALP, or alkaline phosphatase, which is a very easy test to assess as part of the liver function test, and also part of the comprehensive metabolic panel, which is, taken on most of us. It's probably once a year. If you're over 50, if you're less than 50, you may have basic tests done less frequently, but bottom line, it's a very common test, and it's quite commonly comes back low. And usually if you ask your doctor, well, what does that mean? You will say, well, it's not important. And most of the time it is not, unless you have this chronic fatigue, or you have this chronic pain syndrome, or fibromyalgia. Let's just leave it at the term, even though you've heard me just say that questionably it's not a true diagnosis, just a label. Diagnosis is underneath, or actual cause of the problem. So it's a great study, actually, and I'm surprised that it didn't draw more attention. I think I found it, somebody sent it to me. But so what researchers did here, they took 600 patients, over 600 patients in particular center that manages a lot of patients with fibromyalgia. And they did a careful assessment. They looked at, well, how many of them are going to have low ALP? And turns out that that 57 had at least 3 consecutive low measures. So that's that's 10% of patients. And 44 of them had fractures. And then, nobody had certain other tests done that are often associated with low alk phos, and we'll talk about that in a second. But in essence, what does it tell you? In one large center that sees a lot of patients with fibromyalgia, somewhere close to 10% of patients have this. So, well, what does that mean? And what should you do about it, really? And is that something that needs to be checked on every single patient with fibromyalgia? The actual answer is yes, absolutely. Every single patient should have it checked, and if it's low, should be treated. I think that's basically the point, because as you'll hear me discuss this in a minute, the treatment is very easy. So let's take a look at just a kind of a couple very basic points. So fibromyalgia, again, of course, is the kind of a chronic aching condition, or this widespread pain that's often diagnosed by rheumatology by doing the special point testing, but it often comes with lots of other states, symptoms of anxiety and neuropathic pain, just burning pain, but then many other pain syndromes like migraines, etc. Often comes with irritable bowel syndrome, and also, I'm surprised they didn't say this, but also, here this is, that often comes with a fatigue and depression and other things. Now, look at what an official diagnosis of high-phosphatase, or HPP, can cause. And there's a massive overlap, as you can see. Now, this is more severe cases. Those are pretty rare. For somebody to start having something like epilepsy, a seizure disorder from very low phosphate, it would be quite unusual. And honestly, I've never seen this in my practice. But, we're talking about relatively mild cases. And then you see that there's a complete overlap. So patients who have a mild cases can have this muscle weakness. They can have this kind of an unexplained aching, if you will, that are like in this red middle. And so knowing that, the researchers basically said, okay, well, let's carefully assess this. And I'm going to show you just a couple of things here. This is very typical. So patients who typically present with fibromyalgia, they're middle-aged, probably more common women than men. So in this case, there are mostly 80%, so about 4:1 ratio roughly of men to women. And notice that the patients who had a low alk-phos had, as I mentioned, frequent fractures, and they had a much more commonly than expected cases of osteoporosis. For a 50-year-old woman to have 44% of them, women to have 44% of them osteoporosis, that's quite unusual. So this means that these cases are probably more severe in a sense. And also remember, they said 3 consecutive low LP readings. What it means is that the patient has a borderline number and sometimes goes up, sometimes goes down, it wouldn't be even included in here. Now, if you include those patients, the number will be way more than 10%. And I'm actually going to try to do some additional research. Maybe we'll find the students to do this deeper and maybe even write a review. But in short, it looks like that probably we have a quite substantial amount of patients who periodically may drop into a bit low phosphate level. So, and that's basically the result. I'm going to stop sharing and talk a little bit more. So what does all this mean? So okay, let's say you have fibromyalgia. Let's say you've had your comprehensive chemistry done, metabolic panel, and then ALP was low. You go to your doctor, or you went already to your doctor, and you were told, don't worry about it. It's not important. It's not significant. Is it? So I just told you it actually could be quite significant, and I will tell you more. You should treat it. And the way to treat this is one of the 2 things. If the numbers, if the ALP becomes consistently low, and it's pretty low, so it's not like 10, 15, 20% under the normal level, but it's really low, like a half as expected or even less, you should have more comprehensive assessment. You need to have multiple vitamins checked, particularly B6. You also need to check zinc. You need to check calcium. So you need to do more comprehensive assessment to see whether the HPP is a primary condition or maybe secondary. And this gets a bit more medical, and I don't want to go there on this video because I think it's outside of the scope of kind of this general link. But if that's the case, then you definitely need to get treated with a doctor if you have more complex issue. But if you've done some of these tests, or maybe you just know that they are normal and maybe this ALP is a bit low, but only occasional, should you just do something about it once you've learned it? Yeah, and I think you should. And the easy answer is, if you have a normal kidney function, and that's an important point, again, if you have a normal kidney function, there's really no problem taking some additional phosphate and just to see how you're going to feel. Now, interestingly, there are some medical prescriptions for phosphate, something like K-phos, for example. There are also more of a supplemental forms. And I will put some of the ideas in the link, so they're going to be in description. I can give you ideas how you can try to get some of the supplements. But in short, you could obtain them from supplement stores. You can obtain them as a prescription from your doctor, and you can supplement. Of course, you could also ask, well, what foods is phosphate comes from? And phosphate comes in a lot of different foods. If you like your Pepsi Cola or Coca-Cola, very high in phosphates. If you like some other foods like certain fruits and vegetables, I will put the link again that you can review some of the specifics. But I think even more important than that, the point should be, okay, so if the phosphate is a bit low in the tissues, well, why am I aching? So what is the link here? What is the formal link here? Well, the link is that phosphate is a critical molecule, not only to make the bones and basically create the structures, the bones, the amino acids, proteins, etc. It's actually a critical aspect of energy production. So we have to have phosphate in the system to make enough energy. And so the thinking is that the muscles are aching and the fatigue is evolving when phosphate is low because you simply don't make enough energy cellularly. So you don't produce, even though the enzymatic machinery may be in place, but because you have to have phosphate as part of the energy production and it's lacking, you don't make adequate amount. So again, I'll put the links in there. I'm going to try to keep this video short, definitely putting the link to the study in there. And also we'll put, as I said, the list of foods to eat that are higher in phosphate to try. And also I'll write out real briefly as to what specific vitamins you could consider checking. So if you want to run this with your primary care doctor, instead of going straight to rheumatology, you could try to talk about it. But of course, all of this needs to be discussed with your provider. This is not to substitute for your for medical decision making. I'm simply discussing this particular article, which I find quite interesting, very relevant to the practice, since I have seen this as well in my practice. And after reading this article, I started being a bit more aggressive with all my chronic fatigue and fibromyalgia patients, checking them for ALP. I hope this was helpful. I'll see you back covering all the things important in integrative medicine and health. Stay safe. Take care. Bye.